Dr. David Rosen with Jefferson Health joins me now. Dr. Rosen, thank you so much for your time.
Thank you.
Anosmia is this loss of the sense of smell. And while there are a lot of causes that can be linked to anosmia, how does COVID cause it?
COVID is actually directly binding to the lining of the nose through a particular receptor called the ACE2 receptor. The lining of the nose gets damaged, and the cells that support the olfactory cells or the smell cells, they get damaged. So because they lose the supporting cells, the olfactory cells can't function properly. So what you need to do is get those supporting cells to start coming back and allowing that lining of the nose to repair.
Losing the sense of smell can actually impact your ability to really taste and enjoy food, which is so sad.
Yeah, it's very difficult because most of what you consider to be flavor comes from aroma. More patients that have COVID-related smell loss are going to recover than patients that have just regular post-viral smell loss.
I had COVID in September. I still don't have my sense of smell fully back. Is there anything I can do to help bring it back sooner? I guess I thought it would be back by now, and it's not.
Yeah, so the only thing that really has any good scientific proof is doing smell retraining or smell exercises, where you can buy a kit or you can just take, lemon and orange and coffee and perfume and try to smell those things over and over again to sort of retrain your brain to understand that, okay, this is orange. And that really is one of the most helpful things. And the other thing that is helpful if you go to see a doctor is you can do oral steroids or nasal steroids, and that seems to help. There's also some supplements like omega-3, alpha lipoic acid, vitamin A that can also be helpful, although the science is not as good for the supplements as it is for the steroids and the smell exercises.
Do you know what the timeline is for that recovery?
So if you don't recover within 6 months, most likely we need to do something more aggressive to try to help the sense of smell come back.
But it can come back.
It can. And especially with some of the newer treatments that we have available to us that we didn't have available maybe a year or two ago, that's also been a helpful thing to get people's smell back.
You have treatments at the ready that you could administer to patients who have anosmia.
I do. The thing that we've been working on that's been surprisingly successful is taking some of the patient's blood and then spinning it down and getting rid of all the red cells and just saving the plasma, which has all the platelets in it. So you take the platelet-rich plasma and then you apply that topically into the nose, and then that helps the cells regenerate because platelet-rich plasma helps any place in the body regenerate.
Dr. David Rosen, thank you so much for your time. I appreciate it.
You're welcome. It was a pleasure.
Hi, I'm Shirley.
And I'm Regina Mitchell. For more videos like this, subscribe to WHYY.